The SEAL was dying in the ICU. Level 1 trauma center, every doctor in the building had tried. Nothing worked. His vitals crashed, blood pressure 50/30, oxygen at 79%. He was slipping. Then his hand moved, not random. Deliberate, 3 fingers, 2 taps on the rail, a code. The attending didn't see it, but the night nurse did. She froze, her eyes locked on his hand. The SEAL's lips moved. One word, whispered. A call sign. The nurse's face went pale. She knew that name, and he knew hers. Rina Valdez clocked in at 18:52 hours, 8 minutes early, same as always. She walked through the automatic doors of Mercy General's ICU, swiped her badge, and entered the quiet hum of machines and muted conversations. The day shift was wrapping up. Nurses clustered at the station, passing off charts, trading notes, venting about difficult doctors and uncooperative families. Rina walked past them without a word. No one looked up. She moved to the supply closet, restocked her pockets, trauma shears, penlight, alcohol swabs, spare gloves, a small notepad, everything in the same place, same order, muscle memory. She checked the crash cart. Epinephrine, atropine, defibrillator pads, all dated, all in sequence. She adjusted the oxygen regulator on Bay 3's wall unit. Someone had left it loose. Small thing. But small things mattered. By 1900, she was at the bedside of her first patient. Bed 7. Male, 62. Post-op day 3 from a triple bypass, vitals stable on paper, but Rina didn't trust paper. She checked his pupils, equal and reactive. Good, listened to his lung sounds, clear bilaterally, checked his surgical site, no redness, no drainage. She palpated his abdomen, soft, non-tender. Then she noticed his breathing, not labored, not fast, just off. A slight pause at the end of each exhale, like his body was working harder than it should. She pulled up his oxygen saturation, 94%. Normal range, but he'd been at 97% yesterday. 3%, most nurses wouldn't notice. Rina did. She checked his medication list, diuretics, pain management, beta blockers, all standard. But his urine output had dropped over the last 8 hours. She checked the Foley bag, 200 milliliters, should have been closer to 400, fluid retention. Early, subtle. She adjusted his IV rate. Gave him an extra dose of diuretic as per protocol, documented everything. Elevated his legs slightly to reduce venous pressure. Then she moved to the next patient. Bed 4. Female, 71, sepsis. On pressors to keep her blood pressure up. The day nurse had charted her as stable. Rina looked at her skin, mottled, slightly cool to the touch. Her nail beds were pale, not stable, compensating. Rina checked her lactate levels, elevated, not critical yet, but trending the wrong way. She increased the pressor dose, pushed more fluids, watched the monitor. Blood pressure ticked up, 98/62. Better, she stayed for 10 minutes, watched the numbers, made sure they held. They did. She moved on. By 2100 hours, Rina had seen all 8 patients in her section. She knew their rhythms. Their baselines, what normal looked like for each of them. She returned to the nurse's station, opened her laptop, started charting. Around her, the night shift settled in, 3 other nurses. 2 residents, one attending on call, Dr. Brennan, mid-40s, competent but dismissive. He walked past her twice. Didn't acknowledge her, that was fine. Rina preferred it. At 2300 hours, bed 7 triggered an alarm. Oxygen saturation dropping, 89%. Rina was moving before anyone else noticed. She reached his bedside in seconds. The patient was awake but confused. His breathing was faster now. Shallow. She listened to his lungs again. Crackles, bilateral, fluid in the lungs, pulmonary edema. The early signs she'd caught earlier had progressed. She hit the call button. I need Dr. Brennan in Bay 7, now. Brennan arrived 2 minutes later, annoyed. What's the issue? Pulmonary edema, he's retaining fluid. We need to diurese him aggressively and consider BiPAP support. Brennan looked at the monitor. Oxygen sat at 87% now. He frowned, checked the chart. His output was fine this morning. It dropped this evening. I flagged it at 1900. Brennan scrolled through her notes, saw the documentation. He paused, then nodded. Start him on BiPAP. Push 40 of Lasix, recheck in 30 minutes. Already done, Rina said. Brennan looked at her, really looked at her, for the first time in weeks. You started treatment before calling me? Yes. That's not protocol. He was decompensating, there wasn't time. Brennan stared at her, then at the patient, who was already breathing easier. Fine, he said, but next time call me first. He walked away. Rina returned to the bedside, adjusted the BiPAP settings, watched the patient's oxygen climb back to 92%, 94%, he'd be fine. At 200 hours, the ICU was quiet. Rina sat at the nurse's station. Alone, the other nurses were on break, the residents asleep in the call room. She pulled up her charting, reviewed every patient. Every medication, every vital trend, everything was in order. She closed the laptop, looked out at the unit. 8 beds, 8 lives, all of them fragile, all of them fighting. This was the work. Not the codes, not the dramatic saves, the quiet vigilance, the small catches. The things no one else saw. Rina had been doing this for 18 months. Before that, she'd done it in places most people couldn't imagine. Under fire, in the sand, in the dark. Different uniform, different stakes. But the same job, keep them alive, she stood. Walked back to bed 7. Checked his oxygen one more time, 95%. Good, she moved to bed 4, checked the pressor drip, stable. Moved to bed 2, adjusted a blanket, checked an IV site, everything in order. At 3:30, she returned to the station. Sat down, picked up her coffee, cold now, she drank it anyway. The automatic doors hissed open. Rina looked up. 2 paramedics rushed in pushing a gurney. A third ran alongside, squeezing a bag valve mask. The patient's chest was soaked in blood. Behind them, a 4th medic, older, calmer. Level 1 trauma, he called out. GSW to the abdomen, male. Mid-30s, BP 60/40, unresponsive. We've got 2 units in him, he's barely holding. Dr. Brennan appeared from the call room. Residents scrambled. Nurses moved into position. Rina stood. Watched the gurney roll past. Saw the patient's face. Young, strong jaw, tactical watch still on his wrist, shaved head, tattoos on his forearms, military, no, not just military. The way the medics moved around him. The care in their voices, the weight in the room. Operator, Rina's chest tightened. She followed the gurney. No one noticed. They wheeled him into Bay 1. The trauma bay, glass walls, overhead surgical lights, monitors everywhere. Rina stayed at the threshold, watched. The paramedics transferred him to the bed. Dr. Brennan moved to the head. 2 residents flanked the sides. The lead trauma nurse, Kelly, 10 years in the ICU, loud and fast, took position at the monitor station. On my count, Brennan said. 1, 2, 3. They lifted him. Moved him onto the trauma bed. His body was limp, heavy. His chest was covered in blood-soaked gauze. His right hand hung off the side of the bed. Brennan pulled away the dressings, exposed the wound. Entry wound, left lower quadrant, jagged, not clean, the bullet had tumbled. Get me an ultrasound, Brennan said. I need to see what we're dealing with. Kelly grabbed the portable unit. Rolled it over, squeezed gel onto his abdomen. Brennan ran the probe over the wound. His face tightened. Free fluid in the abdomen, lot of it. He's bleeding internally. Pressure's dropping, one of the residents called out. 50/35. Push another unit of ONEG, Brennan said, and get a surgical team down here. We need to crack him open. Kelly moved fast, hung the blood, opened the line. Rina stepped closer, just inside the doorway now. She watched the monitors, heart rate 132, irregular. Blood pressure 48/32. Oxygen saturation 81%. He was dying. Brennan checked the wound again. There's too much bleeding, I can't see the source. Oars on standby, Kelly said. But doctor. Ockaffer's in surgery, ETA 20 minutes. He doesn't have 20 minutes. Rina's eyes moved over the patient, his face, his chest, his arms, then she saw it, his right hand. The one hanging off the bed. It moved. Not a spasm, not random, 3 fingers extended, then 2 taps against the rail. A pattern. Rina's breath stopped. She knew that signal. It was a distress code. Tactical nonverbal, used by operators when they couldn't speak. Medic, internal, hidden. Her eyes locked on his hand. It moved again, a fist. Then 1 finger pointed to his right side. Not the left where the wound was, the right. Rina stepped into the room. Excuse me, she said quietly. No one heard her. She moved closer. Dr. Brennan. He didn't look up. Not now. Doctor, I need you to check his right side. Brennan stopped, looked at her. What? His right side, there's a second wound? The entry is on the left, I know. But there's another one. Brennan stared at her. We already did a full assessment. There's no second wound. Check again. Kelly looked up. Rina, we're in the middle of... Check his right hemidiaphragm, Rina said. Her voice was calm, steady. There's a projectile lodged there. It's compressing the inferior vena cava. That's why you can't stabilize his pressure. Brennan's jaw tightened. That's not possible. We scanned him. You scanned the entry site, not the trajectory. Brennan looked at Kelly. Then back at Rina. Fine, move the ultrasound. Kelly repositioned the probe, ran it over his right side, below the ribs, along the diaphragm. The screen flickered, then showed it. A small, bright object, embedded in the tissue. Right where Rina said it would be, Kelly's eyes widened. Oh my God! Brennan leaned closer, stared at the screen. How did you? He stopped. Looked at Rina. How did you know? Rina didn't answer. She moved to the patient's side, looked down at his face. His eyes were half open now, glassy, unfocused, but they found her. And something shifted. Recognition. His lips moved, barely, no sound, but Rina could read them, 2 words. Who are you? She didn't respond, just looked at his wrist. At the tattoo partially visible under the blood, a trident, Navy SEAL insignia, and beneath it, small letters, a call sign. Havoc, her chest tightened. She knew that name, knew that operator. Ramadi, 2017. Joint Task Force, SEAL Team 3. She'd been attached to them as a special operations medic. This man had been on that team. She didn't remember his face. It had been dark, chaotic. Dust and smoke and gunfire. But she remembered that call sign. And if he was here bleeding out in this hospital, that meant something had gone very, very wrong. Pressure's dropping again, one of the residents said. 42/28, Brennan swore. We need to get that projectile out now. Where the hell is Aakaffer? Still 15 minutes out, Kelly said. He'll be dead in 15 minutes. Rina looked at the monitor. Heart rate 148. Oxygen saturation 78%. His body was shutting down. She made a decision. You need to relieve the pressure on the vena cava, Rina said. Manually. Brennan looked at her. What? The projectile is compressing the vessel. You can't remove it here, but you can shift it. Just enough to restore blood flow. That's not a standard procedure. It's a field procedure. Brennan stared at her. You're a nurse. I'm telling you what will keep him alive, and if I'm wrong. If you're wrong, then he dies, but he's dying right now. You have nothing to lose. Brennan looked at the monitors, at the patient, at Rina, then he nodded. Talk me through it. Rina stepped closer. Palpate the right upper quadrant just below the rib cage. You'll feel resistance. That's the projectile. Apply upward pressure, slowly. Don't push it deeper, just shift it lateral, away from the vessel. Brennan positioned his hands, pressed gently. The patient's body tensed, his breathing hitched. Keep going, Rina said. Brennan pressed harder, shifted his hands slightly. The monitor beeped, blood pressure ticked up. 46/30, 50/32. It's working, Kelly said. Brennan adjusted his angle, pressed again. 52/34, 58/36. The patient's oxygen saturation started climbing. 80%, 82%. Brennan exhaled. Okay, he's stabilizing. Rina didn't move. She kept her eyes on the patient. His hand moved again, slower this time, weaker but deliberate. He extended his hand toward her, palm up, a signal. Thank you. Rina's jaw tightened. She didn't take his hand, just nodded once. Doctor. Aakaffer arrived 12 minutes later. The surgical team prepped the patient for transport. They moved fast, efficient. Rina stepped back, let them work. Brennan pulled off his gloves, looked at her. How did you know? He asked quietly. Know what? That there was a second wound, that it was on the right side, that it was compressing the vena cava. Rina didn't answer. You saw something, Brennan pressed. Something we all missed. What was it? Rina looked at him. He told me. He's unconscious. Not the whole time, Brennan frowned. What are you talking about? Rina turned to leave. Wait, Brennan said. I need to know, are you former military? Rina stopped, didn't turn around. I'm a nurse, she said, and walked out. The surgical team wheeled the patient toward the elevator. Rina followed at a distance. She didn't know why. She should have gone back to her other patients, back to her charting. But something pulled her forward. The elevator doors opened. They rolled him inside. Rina stepped in behind them. Kelly looked at her. You coming up? Just to the OR floor. Kelly didn't question it. The doors closed. The elevator hummed, ascending. Rina looked at the patient. His eyes were closed now. His breathing shallow but steady. The IV line dripped blood into his arm. The monitor beeped softly. He was holding, for now. The elevator jolted slightly as it reached the 3rd floor, then stopped. The lights flickered, and the monitor alarm screamed. He's crashing, one of the residents shouted. Kelly checked the screen. No pulse, starting compressions. She positioned her hands on his chest. Started pumping, hard, fast. Rina moved without thinking. She grabbed the bag valve mask, squeezed, 2 breaths, watched his chest rise. Continue compressions, she said. Kelly kept going. 30 compressions. Rina gave 2 more breaths. The monitor stayed flat. Charging to 200, the resident said. He grabbed the defibrillator, placed the pads. Clear. Everyone stepped back. The shock delivered. The patient's body jerked. The monitor blipped, then flatlined again. Resume compressions, Rina said. Kelly started again. Rina looked at the patient's chest. At the way it moved under Kelly's hands. Something was wrong. The compressions were effective. The airway was open, but he wasn't coming back. Why? She scanned his body, his neck, his chest. His abdomen, then she saw it. His chest wasn't rising evenly. The right side was lagging just slightly. She leaned closer, listened. No breath sounds on the right. Her eyes widened. Stop compressions, she said. Kelly looked at her. What? Stop now. Kelly hesitated, then stopped. Rina placed her hand on his right chest, pressed. It didn't move. It was tight, rigid. Tension pneumothorax. Air trapped in the chest cavity, collapsing the lung, compressing the heart. That's why he coded. He needs a needle decompression, Rina said. The resident stared. We're not in the OR. We don't have time. Rina turned to Kelly. Hand me a 14-gauge needle. You can't. Now. Kelly grabbed the crash cart, pulled out the needle, handed it to Rina. Brennan's voice came through the elevator speaker. What's happening up there? Rina didn't answer. She positioned the needle. Second intercostal space. Midclavicular line, 1 insertion. Straight through, she pushed. The needle punctured the pleura. Air hissed out, a sharp, pressured release. The patient's chest expanded. His body shifted. The monitor beeped. A rhythm, weak. But there, Kelly stared. Oh my God! Rina pulled the needle, secured it, kept the airway open. The elevator doors opened. The surgical team was waiting, staring. Rina stepped back. He's stable, she said quietly, and walked out. The OR team took him. Rina stood in the hallway, alone. The elevator doors closed behind her. The fluorescent lights hummed overhead. Her hands were steady, but her chest was tight. She looked down at her scrubs, blood on the sleeves, not much, but enough. She turned and walked toward the staff restroom, pushed through the door. Stood at the sink, turned on the water, let it run cold, washed her hands, slowly, methodically. The water turned pink, then clear. She looked up at the mirror. Her face was calm, neutral. The same face she wore every shift, but her eyes told a different story. She knew that operator, not his name, not his face, but his call sign, his unit. And if he was here in this hospital, bleeding from a gunshot wound with a hidden projectile, something had gone wrong. Badly wrong. Rina dried her hands, walked back into the hallway. She should go back to the ICU, back to her patients, back to the invisible routine, but she didn't. She walked to the OR observation deck instead. The observation room was dark. A wall of glass overlooked operating room 2. Below, the surgical team worked under bright lights. The patient Havoc was draped and prepped. Dr. Akaffer stood at the table, gloved and focused. 2 surgical nurses flanked him. An anesthesiologist monitored vitals from the head of the bed. Rina stood at the glass, watched. Akaffer made the incision, opened the abdomen, suctioned blood. Explored the cavity. There, Akaffer said. His voice came through the speaker. I see the bleed, hepatic artery, small tear, probably from the projectile migration. He clamped the vessel, sutured it. Moved carefully through the tissue. Now let's find that second wound. He shifted to the right side, palpated the diaphragm, found the projectile. It's lodged deep, close to the vena cava. Just like the nurse said. One of the surgical nurses glanced at the observation window. Rina didn't move. Akaffer worked for another 30 minutes, removed the projectile, a small caliber round. Fragmented, he placed it in a specimen tray, repaired the surrounding tissue, checked for additional bleeding. He's stable, Akaffer said. Let's close. Rina exhaled, just slightly. He was going to live. She turned to leave and found Dr. Brennan standing in the doorway. You followed him up, Brennan said. Rina didn't respond. You performed a needle decompression in an elevator without authorization, without backup. He was coding, there wasn't time. You saved his life again. Brennan stepped closer. Who are you? Rina met his eyes. I'm a nurse. No, you're something else. Brennan's voice was quiet, serious. The way you read him, the way you moved, that wasn't nursing school. That was combat medicine. Rina's jaw tightened. I don't know what you're talking about. Yes, you do. Brennan paused. You were military, special operations. Weren't you? Rina turned toward the glass, looked down at the OR. I'm going back to my unit, she said. Rina, my patients need me. She walked past him, out the door. Brennan didn't follow. Rina returned to the ICU at 5:20 hours. Her other patients were stable. Bed 7 was sleeping. Oxygen at 96%. Bed 4's pressors were holding, no changes. She sat at the nurse's station, opened her laptop. Started charting, but her mind wasn't on the screen. It was on that call sign. Havoc, she remembered the mission. Ramadi, 2017, a joint operation, SEALs and Army Special Operations. They were clearing a compound. Intel said it was a weapons cache. It was an ambush. The building collapsed. IEDs, RPGs, small arms fire from 3 directions. Rina had been attached to SEAL Team 3 as their medic. When the explosion hit, 3 operators went down, trapped under rubble, bleeding, unconscious. The team had pulled back, regrouped. But they couldn't reach the wounded. Too much fire, too much debris. Rina had gone in alone, crawled through the wreckage, found the first SEAL, compound fracture, arterial bleed. She tourniqueted it. Dragged him out, went back for the second, sucking chest wound. She sealed it, pulled him to cover, went back for the third. That one had been the worst, shrapnel to the abdomen, internal bleeding. Fading fast, she destabilized him in the rubble, under fire, kept him breathing until the medevac arrived. She didn't remember his face, just his blood, his breathing, his pulse under her fingers. But she remembered his call sign, Havoc, and now he was here. At 6:40 hours, Kelly found her. Rina, he's awake. Rina looked up. Who? The SEAL, he's in recovery. Asking for you? Rina's chest tightened. He doesn't know my name. He described you, night shift nurse, quiet, the one who found the second wound. Kelly paused. He said you saved his life. Twice, Rina closed her laptop, stood. I need to finish my charting. Rina, I'm not going. Kelly stared at her. Why not? Because I don't need to. He wants to thank you. He doesn't owe me anything. Kelly frowned. What's going on? You've been acting strange all night. Rina grabbed her bag. My shift's over. I'm going home. She walked toward the exit. Kelly called after her. He said something else. He said he knows you from before. Rina stopped, didn't turn around. He's mistaken, she said quietly, and kept walking. But she didn't go home. She stood in the parking lot, stared at her car, key in her hand. She should leave, should let it go. Should stay invisible. That was the plan, that was the life she'd chosen, but something pulled her back. She turned, walked back into the hospital, took the stairs to the recovery floor, 3rd level. Room 8, the door was cracked open. The lights inside were dim. Rina stood outside, listened, no voices, just the soft beep of a monitor. She pushed the door open, stepped inside. Havoc was awake. He lay in the bed, chest bandaged, IV lines in both arms, oxygen cannula in his nose. His face was pale, tired, but his eyes were sharp. He saw her immediately. Viper, he said. Rina froze. No one had called her that in 5 years. She closed the door behind her, stayed near the exit. My name is Rina. That's not what your call sign was. I don't use that anymore. Havoc studied her. His voice was rough, weak, but certain. Ramadi, 2017, you pulled me out of that building, kept me alive until the bird arrived. Rina didn't respond. I remember your hands, Havoc continued. The way you worked, fast, calm, like you'd done it 1,000 times. I was doing my job. You went back in 3 times under fire, no cover, no backup. His eyes didn't leave hers. That's not just a job, that's something else. Rina looked away. You shouldn't be talking, you just came out of surgery. And I'm alive because of you again. Havoc shifted slightly, winced. How did you know about the second wound? You told me. I was unconscious. Not the whole time. Rina met his eyes. You signaled, 3 fingers, 2 taps. Then you pointed to your right side. Havoc's expression shifted, surprise, then understanding. You recognized the signal. Yes, most people wouldn't. I'm not most people. Havoc smiled slightly. No, you're not. Silence settled between them, then Havoc spoke again, quieter. Why'd you leave? After Ramadi, after everything. You were one of the best combat medics in the theater. They wanted to put you in for a silver star. You disappeared before the paperwork even went through. Rina's jaw tightened. That's not your concern. It is if you're taking care of me. I'm not anymore. You're out of surgery. You'll recover. I'm going back to my unit. She turned toward the door. Viper, she stopped, didn't look back. Thank you, Havoc said, for then and for now. Rina's hand rested on the door handle. You're welcome. She opened the door. One more thing, Havoc said. Rina paused. Whatever you're running from, whatever made you leave, it's still there, isn't it? Rina didn't answer. She walked out, closed the door behind her, and stood in the hallway, alone. Her hands were steady, but her chest was heavy because he was right. She was still running. And she didn't know how to stop. Rina didn't sleep. She sat in her apartment, small, clean, minimal, one room, one window, a bed she rarely used. The sun rose outside. Light crept across the floor. Her shift didn't start for another 10 hours. She should rest, eat, decompress, but she couldn't. Her mind kept going back to that hospital room, to Havoc's voice, to the name she hadn't heard in years. Viper. She de-earned that call sign in Kandahar, 2015, her first deployment. A firefight went bad, 2 operators down, the team pinned. She decrawled through 70 meters of open ground, under fire, pulled both men to cover, kept them alive. One of the SEALs had called her Viper after that, said she moved like a snake, silent, fast. Deadly when she needed to be, the name stuck. For 3 years, that's who she was. Then Carter died, and Viper died with him. Now she was just Rina, a night shift nurse, invisible, forgettable, safe. But Havoc had seen through it, and that meant her cover was compromised. Rina stood, walked to the window, looked out at the city waking up. She needed to leave, transfer to another hospital. Another city, start over. Again, she pulled out her phone, started searching for job postings, then stopped. Her hand hovered over the screen. She thought about Havoc. About the way he'd looked at her, the gratitude in his eyes. She thought about the mission, the signal, the second wound. If she'd left her shift early, if she hadn't been there, he'd be dead. Rina put the phone down. She wasn't leaving, not yet. At 18:45 hours, Rina walked back into Mercy General. She clocked in, moved through her routine, checked her patients, restocked supplies. Charted vitals, everything normal, except it was. Kelly found her at 19:20 hours. He's asking for you again. Rina didn't look up from her laptop. I already saw him. He says it's important. Something about his condition. Rina paused. Is he unstable? No, vitals are good, but he won't talk to anyone else, just you. Rina closed the laptop. Fine, I'll go. Roommate was quieter this time. Havoc was sitting up slightly. Color had returned to his face. The oxygen cannula was gone. He was breathing on his own, stronger. He saw Rina enter, nodded. You came back. Your nurse said you had a medical concern. I do. Havoc gestured to the chair beside the bed. Sit. I'll stand. It's not a request, Viper. Rina's jaw tightened, but she sat. Havoc looked at her. His voice was serious now. I need to tell you something about why I'm here, about the wound. You don't owe me an explanation. Yes, I do. Because it's not over. Rina frowned. What do you mean? Havoc glanced at the door, lowered his voice. The gunshot wasn't random. I was targeted by someone who knew my schedule, my location. My route. You're saying it was an inside job. I'm saying someone wanted me dead, and they're not going to stop just because I survived. Rina leaned back, processed. Have you reported this? To my command? Yes, but they can't do anything until I'm out of here, and that's going to take days. So you're a sitting target. Exactly. Rina looked at him. What do you want from me? I want you to know in case something happens, in case someone comes for me. You think they'd try again here, in a hospital? I think they're smart, patient. And they don't leave loose ends. Rina stood, walked to the window, looked out at the parking lot below. You need security. Hospital security won't be enough. You need your team. Or federal protection. My team's deployed, and federal protection takes time. I've got maybe 48 hours before they can get someone here. Then you're vulnerable. That's why I'm telling you. Havoc's voice was steady, calm. You're the only one here I trust. The only one who understands what we're dealing with. Rina turned, met his eyes. I'm not your bodyguard. I'm not asking you to be. I'm asking you to watch, to stay alert. To do what you've always done. Which is, keep me alive. Rina stared at him, then nodded once. Fine, but you do exactly what I say. No arguments, no heroics. Havoc almost smiled. Yes, ma'am. At 23:40 hours, the ICU was quiet. Rina made her rounds, bed 7, bed 4, bed 2, all stable. She returned to the nurse's station, checked the security monitor. The hospital had cameras on every floor, every hallway. She pulled up the feed for the recovery wing, room 8. The hallway was empty, one nurse at the station, no visitors, normal. But Rina's instincts were sharp, honed by years in hostile environments, and something felt off. She stood, walked to the break room, poured coffee, brought it back to her station, sat down. Watched the monitors. At 1:20 hours, she saw it. A figure in the hallway, 3rd floor, recovery wing, male, mid-30s, dark jacket, baseball cap, hands in pockets, walking slowly, too slowly. He stopped outside room 8, looked around, then reached for the door handle. Rina was already moving. She took the stairs, faster than the elevator, hit the 3rd floor in under a minute. Pushed through the stairwell door, moved down the hallway. The man was inside the room now. The door was cracked open. Rina approached, silent. She stayed to the side of the door, listened. A voice. Quiet, cold. You should have stayed down, Havoc. Rina's blood went cold. She pushed the door open. The man stood at the foot of the bed. His hand was inside his jacket, reaching for something. Havoc was awake, alert. His eyes locked on the man. Rina stepped inside. "Can I help you?" she said. Her voice was calm, professional. The man turned, looked at her. "I'm just visiting. Visiting hours ended at 8. I'm family." "No, you're not." Rina stepped closer, put herself between the man and Havoc. "And you need to leave." Now, the man's expression didn't change, but his hand stayed inside his jacket. "I don't think you understand the situation." "I understand perfectly." Rina's voice dropped, cold, steady. "You came here to finish a job, but it's not happening, not on my watch." The man studied her, calculating. Then he smiled slightly. "You're the nurse. The one who saved him." "That's right. You should walk away. This doesn't concern you." "Everything in this room concerns me." The man's smile faded. His hand moved. Rina saw it before it happened. The shift in his weight, the tension in his shoulder. He was drawing a weapon. She moved first. Rina closed the distance in 2 steps. Her left hand shot out, grabbed his wrist, twisted hard. His hand opened. The weapon, a compact pistol with a suppressor, fell to the floor. He swung at her with his free hand. She ducked, drove her elbow into his ribs, heard the crack. He gasped. Staggered back. Rina didn't stop. She swept his legs. He went down hard. She dropped on top of him, knee on his chest, hand on his throat. "Don't move," she said quietly. The man's eyes were wide. Shocked, Rina reached for the pistol, kicked it under the bed, out of reach. Then she looked up at Havoc. "Hit the call button." Havoc pressed it. 10 seconds later, Kelly burst through the door. Saw the scene, froze. "Call security," Rina said. "And the police now." Kelly ran. Rina stayed on the man, didn't move, didn't let up. The man struggled, tried to throw her off. She pressed harder on his throat, not enough to choke, just enough to remind him. "I said don't move." He stopped. Security arrived 3 minutes later. 2 officers, armed, they took over. Cuffed the man, pulled him to his feet. Rina stood, stepped back. Her hands were steady. Her breathing was calm, but her heart was racing. One of the security officers looked at her. "You okay, ma'am?" "I'm fine." He glanced at the man, then back at Rina. "What happened?" "He was attempting to harm my patient. I stopped him." The officer nodded slowly. "You former military?" Rina didn't answer. "We'll need a statement," the officer said. "Later, right now I need to check on my patient." She turned to Havoc. He was sitting up now, eyes on her. Something between gratitude and awe. "You took him down in 5 seconds, Havoc said quietly. 4, Rina corrected. Havoc almost laughed, then winced, held his side. Rina moved to the bed. Checked his vitals, pulse elevated but steady, no fresh bleeding. "You're okay," she said. "Thanks to you again." Rina looked at him. "This doesn't change anything." "I'm still just a nurse." Havoc shook his head. "No, Viper, you're not." The police arrived 20 minutes later. They questioned Rina, questioned Havoc, took the weapon, took the man into custody. Doctor. Brennan appeared an hour later, pulled Rina aside. "What the hell happened?" "Someone tried to kill my patient. I stopped them." "You disarmed an armed assailant in a hospital." "With your bare hands?" "Yes." Brennan stared at her. "Who are you?" Rina met his eyes. "I'm the nurse who keeps her patients alive. That's all you need to know." She walked past him, out of the room. But she knew her cover was blown. By morning, everyone in the hospital would know. The quiet, invisible night nurse wasn't so invisible anymore, and there was no going back. By 600 hours, the entire hospital knew. Rina heard the whispers as she walked through the ICU, saw the stairs, felt the weight of eyes on her back. The nurses at the station stopped talking when she approached. Kelly looked up. "Rina, are you okay?" "I'm fine." "That was incredible, what you did." Rina didn't respond, just opened her laptop. Started finishing her charting. Kelly leaned closer, lowered her voice. "Is it true that you were special operations?" Rina kept typing. "I was a medic." "That's all. That's not what people are saying. People say a lot of things." Kelly studied her. "You're not going to talk about it, are you?" "No," Kelly nodded slowly. "Okay. But for what it's worth, thank you for what you did for keeping him safe." Rina glanced at her. It's my job. No, it's more than that. Kelly paused. You could have walked away. Let security handle it, but you didn't. You put yourself between him and that gun. Rina closed the laptop. I need to finish my rounds. She stood, walked away, but Kelly's words stayed with her. Because Kelly was right, Rina could have walked away, should have walked away, but she hadn't. And now everything was different. At 700 hours, Rina clocked out. Her shift was over. She should go home. Sleep, decompress, but she didn't. She walked to the recovery wing, 3rd floor, room 8. Havoc was awake, sitting up, eating breakfast. He looked stronger, color in his face. Eyes clear, he saw her. Set down his fork. You came to say goodbye, he said. Rina stood in the doorway. How did you know? Because that's what you do. You save people, then you disappear. Rina stepped inside. Closed the door behind her. I'm transferring to another hospital, another city. It's already in motion. Havoc nodded slowly. Because your cover's blown. Yes, you don't have to run, you know. You didn't do anything wrong. You stopped a threat. You saved my life. People respect that. I don't want respect. I want to be left alone. Havoc studied her. Why? Why do you keep running? Rina looked away. Because that's the only way I survive. That's not surviving, that's hiding. Rina's jaw tightened. You don't know what you're talking about. I know exactly what I'm talking about. Havoc's voice was quiet, serious. You lost someone, didn't you? Someone close. And you've been running from it ever since. Rina didn't respond. What was their name? Havoc asked. Silence. Then quietly, Carter, call sign Reaper. Havoc's expression shifted, recognition. I knew him not well, but I knew him. He was a good operator, a good man. He was my best friend. And you were with him when he died. Rina nodded once. I held him, tried to stop the bleeding. But the wound was too deep. The medevac was too far. I couldn't. Her voice cracked just slightly. I couldn't save him. Havoc's eyes softened. It wasn't your fault. I was his medic. It was my job to keep him alive. You can't save everyone, Viper, no matter how good you are, no matter how hard you try. Rina looked at him. Her eyes were hard, but there was pain underneath. That's why I left, because I couldn't do it anymore. Couldn't watch people I cared about die. Couldn't carry that weight. So you became a civilian, changed your name. Tried to forget? Yes, but you didn't forget, did you? Rina didn't answer. Havoc leaned forward slightly. You want to know what I think? Not particularly. He said it anyway. I think you're still the same person, still Viper, still the medic who crawled through fire to save 3 operators in Ramadi. You didn't leave that behind. You just buried it. And last night when I needed you, it came back. Rina shook her head. That was different. That was instinct. No, that was who you are. Silence settled between them. Then Havoc spoke again. Quieter, you saved my life 3 times now. Ramadi, the ER, last night, I owe you more than I can ever repay. You don't owe me anything. Yes, I do. Havoc reached into the drawer beside his bed. Pulled out a small wooden case, handed it to Rina. She took it, opened it. Inside was a Navy SEAL trident pin, gold, worn, the edges smooth from years of handling. This was mine, Havoc said. From my first deployment, I want you to have it. Rina stared at it. I can't take this. You can and you will because you earned it, not just for saving me, but for being the kind of person who puts others before themselves, no matter the cost. Rina's throat tightened. She closed the case, held it. Thank you, she said quietly. Havoc nodded. Take care of yourself, Viper. Rina met his eyes. You too, Havoc. She turned to leave. One more thing, Havoc said. She stopped, looked back. Wherever you go, whatever name you use. You're still a medic, you're still a warrior, don't forget that. Rina held his gaze for a long moment, then nodded once and walked out. Rina left the hospital at 7:30 hours. She walked through the parking lot, got into her car, sat there for a moment. She opened the wooden case, looked at the trident, ran her thumb over it, then closed the case. Put it in her glove compartment, started the engine, and drove. 3 days later, Patricia Crane received a resignation letter, effective immediately. No explanation, no forwarding information. Rina Valdez was gone. Kelly checked her locker. Empty. Dr. Brennan pulled her file. Home address was a P.O. box. Phone number disconnected. She'd vanished, just like she always did. Havoc was discharged on day 5. He walked out of Mercy General with a cane and a security detail. His team had arrived, federal protection in place. Before he left, he stopped by the ICU. Asked for Rina Valdez. The charge nurse shook her head. She doesn't work here anymore. Where did she go? We don't know. She resigned, left no forwarding address. Havoc nodded slowly. Figures, he walked to the window, looked out at the city. If you see her again, he said quietly, tell her thank you and tell her she's welcome back, any time. The nurse nodded. I will, but they both knew they wouldn't see her again 6 weeks later. St. Vincent Hospital, Portland, Oregon, a woman walked into the HR office. Mid-30s, short dark hair, calm eyes. She filled out an application, provided references, all clean, all verified, name, Sarah Castellano. Position, ICU nurse, night shift. The hiring manager reviewed the file. You have excellent experience, why the move to Portland? I wanted to change, somewhere quieter. The manager nodded. Well, we're happy to have you. When can you start? Tonight. That night, Sarah Castellano clocked in at 1900 hours. She moved through the ICU, restocked supplies, checked crash carts, familiarized herself with the layout. No one knew her, no one asked questions. She was invisible again, exactly how she wanted it. At 2100 hours, she took her first patient. Bed 3, male, 58, post-op cardiac surgery. Vitals stable on paper, but Sarah didn't trust paper. She checked his pupils, listened to his lungs, palpated his abdomen, then she noticed his breathing, a slight pause at the end of each exhale. She checked his oxygen saturation, 93%, normal range, but lower than it should be. She adjusted his IV, gave him a diuretic, elevated his legs, then moved to the next patient. Quiet, efficient. Invisible, at 200 hours the ICU was silent. Sarah sat at the nurse's station. Alone, she pulled out her phone, opened her photos, scrolled to the one she'd saved, the Trident, Havoc's Trident. She'd taken a photo before she left, to remember. She stared at it for a long moment, then closed the phone, put it away, stood, walked back to her patients, because that's who she was, not Viper. Not Rina, not Sarah, she was a medic, and medics didn't stop, didn't quit, didn't walk away. They just kept moving, kept working, kept saving lives, quietly, invisibly, until the next crisis came. And when it did, she'd be ready. 2,000 miles away, Havoc sat in a secure briefing room, his team around him, his commander at the head of the table. You're cleared for duty, the commander said. Full medical, no restrictions. Havoc nodded. Good. We have a new tasking, high priority. Wheels up in 72 hours. Understood. The commander paused. One more thing, we never found the person who ordered the hit. They're still out there. I know, you'll need to stay alert. Watch your six. Havoc almost smiled. Always do, sir. The briefing ended. The team filed out. Havoc stayed behind, pulled a small wooden case from his pocket, opened it. Inside was a second Trident. Identical to the one he'd given Rina. He'd had two, kept one, gave one away. He stared at it, thought about Ramadi, about the rubble, about the medic who'd crawled through hell to save him. Thought about Mercy General, about the nurse who'd stood between him and a bullet, thought about Viper, wherever she was. He closed the case, stood, and walked out, back to the war, back to the fight. Because that's what operators did. And somewhere in a quiet hospital on a quiet shift, a medic was doing the same.